good afternoon. If you are in the Eastern Standard Time Zone, good evening. If you are across the pond, as they say, and in one of the continents on our beautiful planet, my name is Denise Octavia Smith, and I bring you greetings from Hartford, Connecticut. Thank you so much for taking time out from your busy day to join the National Association of Community Health Workers. We're letting folks into the chat, so we're going to give it about another minute and want to acknowledge each and every one of you. So grateful that you're with us, and I pray that all is well with you, with your families, with your communities. If you want to introduce yourself in the chat, if you're not a member and you want to make sure that we know you're here, you are interested in connecting with NACHWA, please feel free to use the chat liberally today. We'll get to as many thoughts and comments as we can. Aurora, just as a preview, if you could bring up the first slide. For all of you who are members, you are a community health worker, you are an auntie, you are an outreach worker, you are a volunteer health technician, you're a community health representative from a tribal nation.
I think it'll be more interesting than
I just want to say hello. And I want to thank you for membership if you are an individual or organizational member. Let's bring up that first slide. We are rounding out the month of December already. I can't believe how quickly it's happened. And this has been an incredible year of growth and development for our organization. We're going to share a little bit with you some background of the National Association of Community Health Workers, and then quickly we'll get into the topic of the day, which is really around—
I'm sorry, I had a meeting that started at 1.
Of the capacity and needs of networks.
That's great. I think that's exactly the kind of thing.
We're going to ask folks to mute themselves as they come on. Thank you so much. When you come on, just check your mute and please introduce yourself in the chat so that we have a chance to get to know you better. So we're still filling up. We'll give it another moment, and then we'll get the slides up and we'll begin. Seeing people from all over joining us. Thank you so very much. So here's some great news for us to end 2021. The National Association of Community Health Workers can now say that we have membership in all 50 states. We want to thank each and every one of you if you are a member. And if this is your first time hearing about the National Association of Community Health Workers, we will follow up with you if you are interested in membership. We invite you to visit our website, and I'll ask one of our team members to throw that into the chat. And we invite you to reach out and engage us with what you are doing, what your strengths and your needs may be, and how we can authentically partner together. As I begin, I just want to acknowledge the 2 team members who are on the call with me today. Aurora Grant Wingate, who is our member and partner engagement associate. This was her coordination to bring this event together. And so I want to thank her very much for that expertise. I also want to thank Peter Salale for joining us as a team member in marketing and communications. And they will be connecting with you in the chat, sharing
you do not
and materials. Thank you so much. I appreciate muting as they come on. And I know that we have people representing many different states and countries. And I just want to, again, acknowledge each and every one of you. And I pray that all is well with you. Next slide, please. We're going to get right into this because we have a really full day. So today we're talking about CHW network capacity and support needs during the COVID-19 pandemic and beyond. If you're here with us today, you're going to learn and see some of the data that we have been collecting from March 2020 until around the end of October, and talk about not only what we've learned, but how we have been responding and what our hopes are to continue to respond. Of course, we're going to offer ways that you can partner with us, resources that you can use if you are thinking about developing your own network or association. And if you are not a CHW, if you're not a promotora, if you're not a community health representative, if you are what we call an ally, you're working in public health, you're a researcher, you work with state government, you work with a nonprofit organization, you're a funder, you're an employer. We're also going to give you ways that you can partner with these networks. Next slide, please. So as I mentioned, I am so honored to be the founding executive director of the National Association of Community Health Workers. NACHWA is our acronym. We were founded in April 2019 as a 501c3 nonprofit member-driven organization. This was several years in the making, planning and organizing by CHWs and allies. And our mission, really our vision, is to unite CHWs across ethnicity, across geography, across sector, identity, and experience, so that together we can support our communities to achieve health, equity, and social justice. And as you can see from the slide, we do this in a variety of ways. I won't read everything here, but we're engaging lots of different stakeholders. We're trying to expand the idea of our workforce, the definition, the scope, the roles of our workforce, the uniqueness of our workforce. We're lifting up leadership from CHWs and promotoras and outreach workers from across the United States. And while we are a young organization, just coming up on 3 years, we are moving toward establishing NACHWA as a national voice on behalf of our members. As I use the term community health worker, let me just take a moment to define. I use the term community health worker as an umbrella term to include community health representatives from tribal nations, our promotoras, our peers, and many other workforce members identified by different titles or different identities. All of us as frontline public health professionals, racial equity advocates that uniquely share our life experience, trust, relationship, compassion, culture, and value alignment with the communities where we live. The organizational values of NACHWA are self-determination for the workforce, self-empowerment for the workforce, integrity of our character, dignity and respect for every human being, social justice and equity to ensure fair treatment and access and opportunity and outcomes for all individuals and communities. These are North Stars that we use to support our members and to foster partnerships, to advocate across the US, to develop our strategic objectives and to assess our impact. Next slide, please. So I want to take just a moment as you're starting to get some grounding on what a CHW network is, You'll see here on the slide that we are defining this organization as, and it could, we sort of summarize this as a network, but this could also be a CHW association, a CHW coalition. Unique definition includes that these organizations are led by or co-led by community health workers. And again, we include our promotores, our CHRs, our peers, and many other identities within our profession. But these organizations were often founded by, they are led or co-led by our frontline workforce. And these organizations, while they do many, many things, and you see this listed on the bottom, they have a focus on building membership across sector, networking with CHWs and promotores across their region, across their geography, across funding streams. They seek to mobilize and work on policy and advocacy and workforce development together as a united front. So while these workforces do train CHWs, they may provide core competency training, training for supervisors. They may advocate for state policy or help develop sort of documents around equitable pay. They may host conferences or summits. They can have training registries or master lists. They may be direct service providers. They may be contracting with health centers or primary care or state government, many different things. But the heart of this is that this is coming from the workforce itself. So I hope we make that clear. One of the reasons that we are really focusing in on these types of organizations is because the COVID-19 pandemic highlighted several persistent, historic, systemic challenges facing the United States, including, not the least of these, are racial injustice and inequity, including and sort of resulting in a lack of public health workers who are diverse and representative of the communities that are being served and engaged. This resulted during COVID-19 in a weakness in pandemic response and other emergency readiness. There has been a historic lack of investment, resulting in lack of capacity for these organizations, a lack of equitable partnership with these organizations that are rooted in community. And so racial health inequities often persist in these communities, and these organizations are attempting to respond. But because CHWs are from the community, we are also a precarious workforce. In other words, we're some of the lowest paid. We are mostly female, not exclusively. We are mostly women of color. We are survivors of rare chronic disease. We are people who have experienced HIV or homelessness. We are those people who have survived community or structural violence. So often we are just as precarious as the communities where we are serving. As the Biden administration is dedicating unprecedented funding in the United States to develop the public health workforce through American Rescue Plan funding, NACHWA believes that community health workers and community health worker networks are critical partners to rebuild and reimagine our public health workforce. But these organizations need to be understood, they need to be resourced, they need to be partnered with, and they need to be sustained. These organizations are well positioned, right? They're culturally aligned. They're trusted anchor institutions at the local level, at the county level, or sometimes at the state level across the United States. And they're addressing a myriad of challenges, but often need support in technology, communication, or perhaps even mobilization strategies to really advance and sustain policies that will respect our workforce, protect our workforce and authentically partner with us. Next slide, please. So in May 2020, NACHWA hosted a national webinar to explore data that was collected in really the first national survey of CHW member organizations. I use CHW networks as a shorthand. This came with funding from support from Sanofi and the Boston University School of Social Work. It was a 26-item survey, and it asked questions about the characteristics of the organization, the membership structure, the governance of the organization, and the different sort of programming that these networks across the country would provide. So the study surveyed 40 unique networks at the time. The survey was implemented in 2017, and the report came out in 2018. And I'll just sort of highlight a few pieces of what this report found. 2/3 of these 40 networks that were surveyed were founded in the last decade. That could be sort of aligned with the movement that we saw in the United States around the Affordable Care Act. There was sort of an increased focus and understanding of the role of community health workers as health professionals. And so some of those organizations may have benefited from state funding that came into their area and helped develop these organizations. 90% of the 40 networks that were surveyed were launched in the last 25 years. 50% of these networks have no paid staff. So I want you to just think about the fact that I said these organizations are training, they're networking, they're mentoring, they're giving their subject matter expertise, they're weighing in on state policy, and may not even have one full-time staff member to do any of this sort of operational related sort of activities. Most of them, 50%, have an operating budget of $50,000 or less. 50% of them stated that grants and membership dues are the primary source of revenue. And again, if you think about CHWs as the lowest paid among all public health workers, you can imagine that these dues are not in the hundreds of dollars, but they may be $10, $20, or $30 for the year. So I'm not going to go through the entire report because again, we had this webinar in May of 2020, but this study, many of these groups lack the capacity or leadership to tackle some policy issues where it's very critical for CHWs to be weighing in on. The data from 2017 indicates that many individual CHWs across the United States have no existing CHW network or association or coalition. You may be one of those CHWs. If you're in a city, a county, or state that does not have an association, a coalition, a network, let us know. Let us know what state you're in. Let us know whether or not you're a member of an association or coalition. So today, as I mentioned, we're not going to be presenting all of the details, but I believe Peter Salale just put into the chat a link to the full report from 2018. And also, if you want to visit our YouTube channel, you can take a look at the webinar that we did in May 2020. But what's important here is that since that time, and Aurora, if you can go to the next slide, since that time, we have been building on the results of that initial study. As I mentioned, I came on in November 2019 as the founding ED, and just within 4 months, the pandemic, came to the US shores in a very profound and concentrated way. And so right away, NACHWA began calling on these CHW networks to meet in national town halls. We started out by just disseminating COVID information, by asking them for resources, and we helped stand up a COVID-19 website for CHWs and for our networks. But we also wanted to just create space to learn about what these networks were doing, how they were pivoting, how they were supporting their members. Some of them were actually founded during the pandemic. So this is not just a story of lack. Incredible things were happening with our networks. They were becoming mutual aid societies, delivering food and diapers. And I'm sure many of you have this story. They were still working on workforce development, and they were trying to partner with states, with hospitals, with COVID response. But it was difficult often because oftentimes our organizations don't have the same agency and voice. We're not recognized for our community expertise. So in these town halls, and we've done about 20 of them in the past year, we've been providing updates and opportunities for funding when we can. We've been doing some capacity building sessions, talking about how these networks are showing up in their states around policy, around CHW sustainability. And so I'm going to hand this off to Aurora Grant Wingate now, and she's going to talk to you a bit further and go a bit deeper on some of this data. Aurora, thank you so much.
Thank you, Denise. As Denise said earlier, I've had the pleasure to work for NACHWA for just over a year now as their Member and Partner Engagement Associate. And I've also had the pleasure to be able to attend and work on so many of these town halls. So I'm going to spend around 15 minutes just going over some of the data that we have accumulated over the last a little over a year. This data is sort of put into two buckets. First, we're going to talk about sort of the big issue at the moment, COVID, which has been what has been the focus of so many of the town halls. And after that, we're going to go a little bit beyond COVID and looking at the policy needs and the capacity needs and the funding needs that CHW networks have spoken to about in the conversations we've been a part of. And while we're often going to be talking about the needs of the CHW networks, I also want to make sure that we are highlighting all the great strengths, everything that they are already doing, as Denise mentioned, during COVID and beyond, and everything they're doing for CHWs or CHW employers and for public health and health equity in general. So first, I'm going to take you guys back a little over a year to October 2020. This is still pretty early on in the pandemic. This is one of our early CHW network calls. And this is around the time I just came on to NACHWA. And to let you know, this is right around the time I think folks were starting to see and hear about CHWs. They're starting to think community engagement is really what we need to move forward in the pandemic. And here we asked these CHW networks in their state and during the pandemic, CHWs are somewhat well understood or not well understood for their role in strengthening public health. And as you can see, the majority of respondents, 60%, said that CHWs were somewhat understood in their role in the pandemic. And then fewer said they were well understood, and even fewer said they were not well understood. And I think this is a really great to reveal what the CHW networks are sort of up against. Are they working with folks who well understand CHWs in general and CHW networks? Some of them were, but more of them were doing some of that educating themselves. And in the same moment in October 2020, we asked a little bit more about the different roles CHW networks were playing during COVID. 30% said they were developing basic COVID-19 trainings. 20% said they were developing new partnerships with different levels of public health departments. Many of them were increasing their CHW network memberships. They were directly hiring CHWs, developing self-care, and advocating for CHWs at the local, county, and state level. And I think this is a great to pause on for a moment. As I go through this presentation, some of these questions we have repeated, and you can see some of the change over time for what the roles they're playing, for the advocacy they're doing. So now we are going to jump forward a few months to February 2021. We are just coming off the very highest of case levels basically in US history. We just had the vaccine for just a few months and not all folks were eligible. And we asked the CHW networks what supports they were giving to the community around COVID-19 services. And 100% said they were educating community members about myths and answering basic questions. Over 50% said they were providing social needs services and referrals to those affected by COVID-19. Others were also helping lead COVID-19 local response efforts. And some were even administering COVID-19 vaccines, doing COVID-19 contact tracing and administering COVID-19 testing. And again, those are some of the things that we want to celebrate, to think that these CHW networks, even as Denise said earlier, are under-resourced and often lack sustainable funding. They are making this large impact in their communities. And then a couple months later, in April 2021, we asked them what types of funding that they would need to increase and improve their COVID-19 response. The biggest need was just human resource funding. They needed money to pay staff to do all that work that we talked about. Many others also needed policy and advocacy development, money for their programs and services, like that COVID-19 testing, like administering the vaccine. Other needed help with leadership development and things like operations, paying for internet, paying for your data services, your newsletter, all of that costs money. And then 44% also said just infrastructure, paying their rent, paying for facilities, their board development, and their communication with their members. And after NACHWA has seen so much of this data, and after we had been in communication with the networks for over a year, we have worked to develop many resources in response to these needs. We have helped co-found 2 coalitions, one being the Vaccine Equity Cooperative and another being the Community-Based Workforce Alliance. The Vaccine Equity Cooperative is part of a larger health equity movement that we are a part of with many other fantastic organizations like Health Leads, Partners in Health, Native Ways Federation, and others. And that is really an entry point into talking about health equity broadly and really lifting up CHWs within that work. We put on more than monthly webinars lately around different hot topics around COVID and lifting up community-based work. We have been doing advocacy around funding and legislation that's come around COVID. We've also put out a repository of different communications, different resources, specifically curated by community health workers. And you can sort that by community type and also by resource type, so you can find what you're interested in. The Community-Based Workforce Alliance is something that NACHWA helped co-found, again, with many other fantastic organizations, right on the onset of COVID-19 to really advocate for a community-based workforce response to COVID-19. And since our founding, we have done a lot of work around the funding of community-based organizations. Sustainable funding can often be the #1 barrier to community-based workforces and organizations working at the top of their scope. And I'm going to talk in a few minutes a little bit more about different funding TA that we have done as the CBWA. Also, as we just talked about all those different funding needs that CHW networks have, we recently, as NACHWA, co-authored a VEC blog addressing systemic inequalities and racism and community-based organization funding. That blog post goes through some of the barriers that CBOs and CHW networks have to accessing funding, as well as give some recommendations for policymakers to start to change and improve that so community-based organizations can obtain these funds. We put out our first NACHWA policy platform, which addresses CHW's needs during COVID, but more broadly. We have also put together a NACHWA COVID-19 resources page where you can learn about all of these and find all of these links and much more. There are trainings and webinars and other resources, and we're constantly updating that. At the beginning of the pandemic, the CDC invited NACHWA in to partner with them to create the first COVID-19 resources specifically curated for CHWs and community health representatives and promotoras. And that is still up and running. It's a great place to see up-to-date resources. NACHWA has also launched the CHW Network and Training Programs page. So no matter who you are, I strongly encourage you to take a look at that page and see what the CHW infrastructure looks like in your community. If you're a CHW, I encourage you to join and see what opportunities. If you are an employer or a funder, there are definitely opportunities for you to be involved as well, and I encourage you to get involved. We also want to touch on a little bit all the great funding that has come down since the change of administration for public health. One of those opportunities was the CDC 2109 and 2110 grants. And here is right when they first announced the grant in April 2021, we asked the CHW networks if they were aware if their state was intending to apply for one of these opportunities. A little under half said yes, and a little under half said they were unsure. This was right after the grant was announced. And we also asked these same networks in April if they were going to be a partner in their state CDC funding proposal. A little over a quarter said yes, they were going to be included. 63% said they were unsure, which for us at NACHWA is a great opportunity for us to do advocacy, to connect people to their state. And if anyone on the call is a state health department, this is a great moment for you to connect with your CHW network and think about when these funding streams are coming down to connect with them. Similar to the CDC funding, there's also been a number of different HRSA grants that have come down from the federal government. And as the CBWA, we heard from many CBOs that they were struggling to apply for that funding. So we partnered with HRSA to come up with this technical assistance session to answer common questions and try to address some of those common barriers that sometimes smaller organizations can face when trying to access those federal funds. If folks are interested in that, they can absolutely visit the Community-Based Workforce Alliance's website. There's the recording, the slides, and the Q&A with folks from HRSA on the line. Also, I should mention that all of these slides and all of the links are going to be sent out to all of you after the call, so don't feel pressured to be writing anything down. So now to twist a little bit to looking kind of beyond COVID, and what are other sort of needs and strengths of the CHW networks in the past year. We asked if CHW networks were providing their CHWs training in policy development and advocacy. 60% said they were already doing some of this work. And then we also asked if they were doing advocacy on a state level around legislation, around CHW policy, and 80% said yes, they were currently looking to move legislation. And this is one of the probably most important pieces of data we had. We asked CHW networks, what would you like to see NACHWA provide to help you build your capacity? 84% said help to secure sustainable funding for their CHW networks. Others said evidence-based resources, language to promote CHW professional identity, help with state level policy. More said help to develop partnerships and help with the NACHWA Document Resource Center. In response to some of these, this data that we collected, Denise is going to talk a little bit later about all the different trainings that we have offered and the resources we have curated, and also the additional work we're going to be doing looking forward to 2022. Sort of the last bit for me is I really want to highlight the strength that the CHW networks have already in their partnerships. We asked in February 2021 for the CHW networks, who were they already partnering with? And as you can see, they're already, many of them working with public health departments, primary care providers, FQHCs, faith-based organizations, and more. And I'll let you know, we did have a space for organizations to write in the other, and many of them were talking about partnering with other CHW networks, with other CBOs, and with other social service providers, because as we saw earlier, they're making those referrals, they have those connections. And we also asked if CHW networks were partnering with employers to recruit CHWs. And as you can see, the majority said absolutely that they were working and recruiting CHWs. Many CHW networks put out job postings. They'll work directly with employers to make sure CHWs get hired. We also asked that were the CHW networks providing training for CHW employers and supervisors? And 70% said yes, they were. And this is actually very recent from just last month in November. So if you're someone on the phone who is an employer or a supervisor, I really encourage you to reach out and get connected with your CHW network. It can be a huge benefit for you, for your organization, and for the CHWs that you support. We also asked, does your CHW association partner with state and local health departments to recruit CHWs? And 73% said yes, that they were working with health departments to recruit CHWs. We also asked, would your organization have the capacity to subcontract and supervise CHWs for your local or state health department? And 35% said yes, this is something that they were absolutely capable of. 45% said they were unsure, which again is a great sort of entry point to talk about what are some of the models, how can we facilitate that happening. If folks on the call, again, if you're a public health department, CHW networks have such great strengths and they have so many things to offer. So it might be a great entry point for you to reach out and see if folks can work with you in that capacity. And again, this is very recent data from November. So in summary, some of the biggest needs of CHW networks are development and policy and advocacy, communications and operations. And a lot of this has to do with funding. Again, 84% said help to secure sustainable funding was their #1 priority. And again, many said help with state level policy and language to promote CHW professional identity. And before I hand it back to Denise, I want to say if there's anyone on the call who represents the CHW network, or if you're someone on the call who wants to have an introduction, or you're having trouble connecting with folks in your state, please feel free to reach out to me. I'm happy to facilitate these connections and make sure everyone is getting all the resources they need. At this point, I'm going to hand it back to Denise to talk a little bit more about our resources and things that are upcoming.
Thanks so much, Aurora. I'm just going to spend a couple of minutes and then hopefully we'll be able to get to some questions. I just threw a question into the chat. You know, tell us why you joined the webinar. Tell us if the data and the information that we're sharing now is helpful for you, how you might use this information to take it back to your CHW network, to your state, to your organization. So we'd love to get some feedback from you as we sort of enter the last 20 minutes. Lots of ways to partner with CHW networks, and Aurora has already put out the call to action because we've talked clearly about what these organizations are already doing, their capacity, certainly their potential, as well as we've been very frank about some of those systemic resource deficits. If you're a public health department, state or local county health department, or if you're an employer of CHWs, a hospital, a private organization, a community-based organization, contract with these networks using funding from the Centers for Disease Control. There is established funding from CDC. Some of these funding sources are sort of winding down, but they support state level infrastructure around community health workers. As well, many state agencies are thinking about ways to pivot some of their COVID funding in this same way to develop the workforce and infrastructure more fully. Right now, as we mentioned, there is still a rapid scale up of public health workers across the country in rural, urban settings, working with hospitals, FQHCs, working deep in community. These organizations are ready to recruit, to help you hire, to train, and to supervise community health workers. Connect with them as authentic partners to develop best practice around COVID-19. As we mentioned, the core identity of a community health worker is the shared life experience, the trust, the relationship, the cultural alignment with the communities that many organizations right now during COVID are frankly having difficulty engaging. And so here's an important way: by elevating, prioritizing, centering the voices of CHWs, you're drawing in more diversity and community voice. Bring them in as advisors if you're at the state level and you're focused on workforce development, you're focused on Medicaid and the roles of community health workers in Medicaid services. If you're looking at policies around equity, maternal and child health, access to care, there are a myriad of ways in which these communities can leverage and share their expertise. Also, if you're an employer, we encourage you, if you have CHWs that you employ, whether through grant or sort of operations funding, you know, it takes $20, maybe $30 for you to purchase a membership for your CHW employee to be able to attend and be a member of a network. They benefit from mentoring, from professional development, from policy development and advice, and build in time into the day, the week, the month of your employee to be able to build their professional development and mentoring network by attending these meetings. If you're another ally, you can see here on the chat, CHW networks need this funding. We all know a lot of grant funding does not robustly invest in operations, infrastructure, or capacity. It's often focused on service delivery, the number of units, the number of individuals serviced. If you believe that a strong CHW association means a strong and diverse and capable public health workforce at your local, county, or at your state level, then invest and develop funding opportunities that acknowledge this and that fund operations, infrastructure, and capacity. And of course, CHW networks are mentoring and they're developing identity campaigns at the state level. There are exciting things happening across regions where a number of different CHW associations or networks in states are coming together to talk about reciprocity, to talk about sharing training, competencies, and other materials. Next slide, please. Okay, so here are some resources that we just want to voice over to you quickly. Someone in the chat said, could you please talk about national certification? That's not what this webinar is completely about, but first I want to direct you, you can visit our website, you can visit our YouTube page, or you can wait until these slides reach your email inbox. There's a webinar that we did in March 2020 based on national data on what CHWs and our networks and associations are doing with partners and allies in their states right now around certification. Every state does not have legislation around certification. Some states don't even have a clear scope of work for community health workers. And so there's more that you can find out about that on our policy page or visit the webinar to get more resources. Aligned with that, however, I just want to say that while NACHWA, we do not train CHWs, we're a member and an advocacy and a capacity building association. Our partners and members are CHW networks and individual CHWs and allies. We want the dollars for training. We want the dollars for partnership to go into the networks and associations across the country. So we don't develop or stand up our own core competency training, but we do offer the National CHW Core Consensus Project, is called C3, as a starting place for you if you are a CHW, a promotora, a CHR, a tribal nation, if you're an ally, and you are considering building on what it is that the workforce has put forward. What are our descriptions of our scope of work, our roles, our skills, our competencies? Also here on this slide, we have a link to our national policy platform. Briefly, in February of this year, NACHWA had been working with hundreds of individual CHWs, organizations, and allies. And really, we were trying to aggregate policies that in many cases had been around for many years or sometimes even decades. But we wanted to pull this into one document that would give guidance, policy recommendations to public and private institutions, whether you're a from philanthropy, whether you're a hospital, you could be a state or federal legislator, you could be working as a federal agency, a Medicaid office. These are policies for you to respect, protect, and authentically partner with our workforce. And then finally, we've got some what I think are really exceptional reports, mostly because they draw on the voice and experience and perspectives of our national membership. And so you can take a look at some of those. And then finally, we have begun to write a more fully around sustainable financing for community health worker employment. You'll see links to the brief, the full report, and a recording of a webinar by a true expert and a true ally of CHW's, someone who's been doing this consulting and subject matter expertise for decades, Carl Rush. And so we offer those resources to you. Next slide, please. Okay, want to give a quick shout out to our partners and the initiatives that are going to be taking place in 2022. Aurora already mentioned the Vaccine Equity Cooperative and the Community-Based Workforce Alliance. Back in 2020, we started partnering with the Morehouse School of Medicine and their National COVID Resiliency Network. That work will continue into 2022. Big shout out to the RX Foundation, who was a foundational partner for NACHWA to launch in 2019. And they have stayed on as a strategic partner to help us support policy and advocacy development for CHWs and our networks. Big shout out to Johnson & Johnson. We really just started developing a relationship with them last year. They helped to fund a national survey that we developed with CHWs, that we implemented, and we'll be sharing that data across the country. If you're interested in that data, invite us to come and present data on CHW national professional identity, policy leadership, and organizational capacity. 51 questions with a 99% response rate on all of the questions, over 850 responses in over 600 zip codes, and over 25 different languages of CHWs represented. So we're thrilled to share that data. And then finally, with ASTHO, the Association of State and Territorial Health Officials, we're going to be strengthening our partnerships with them to make stronger connections at the state level with CHW networks, associations, and coalitions. Next slide, please. Okay, so if you're interested in staying connected to us, here are some things happening in 2022. That sustainable financing report that I just mentioned from Carl Rush will come in the form of a really interactive webinar and TA session for CHW networks in January. In February, we're going to share with our members a number of graphics and reports, infographics, and messaging really around national CHW professional identity. It's still very much the case that we meet with people who say, you know, it's hard for me to describe who a CHW is. You know, there's so many titles and they work in so many different sectors. We do have core qualities and competencies that align across sector and across geography and across ethnicity. So you're going to hear more about that, and we invite you to become a member and use these tools to advocate in your organization, at your state level, or wherever your area of influence is. In March, we're going to be doing some deeper policy and advocacy development, and we're also going to be reinvigorating our national policy platform. So if you've seen that platform before, as I mentioned, it was released in February 2021. We want to make sure that we are always going back to that document to make sure that we are inclusive of the experience, the environments, the capacity, the preferences, the best practice coming from the workforce and our allies. And so we invite you to come and engage with us as we enhance that document and as we make that document actionable to transform policy to sustain our workforce. And then finally, in April, there'll be another training for CHW networks on our Document Resource Center. This is a document resource center that is now available on our website. If you go to our policy page and scroll all the way down to the bottom, this is a searchable database. So if you want to know what's happening with certification in state X, what's happening with core competency development, what about legislation to define the workforce? How are CHW networks and workforce development subgroups getting together? What are they building in their states? What are the recommendations? You can read the meeting minutes. You can look at the agendas. You can look at the reports. We want to thank the National Association of Chronic Disease Directors and the Centers for Disease Control for funding this critical work. Over now, 950 documents are included in this searchable database. So those are some of the things that are coming up for the new year. Next slide, please. Okay, and then finally, through, again, funding from the RX Foundation, we launched in October 5 national learning collaboratives. And we had an incredible first kickoff meeting in October. We asked our members in the months of July and August, you know, how else can we help them come together so that they can listen to one another, so that they can learn from one another, network, mentor one another, and so that NACHWA can hear their voice and support where they want the workforce to go. And so there are 5 learning collaboratives that we have recently launched. One is, and let me just clarify, this is for CHWs. So allies, we will have other opportunities for you, but this is for CHWs who are either identify in one of these categories or you are serving one of these populations. So for CHWs working in or who identify with a mental health, CHWs serving or identifying as an immigrant or refugee, we have CHW organizational leaders, a special collaborative for you. For community health representatives, these are our CHWs on our tribal nations. They may be working through reservations or in urban settings, but they are members of tribal nations, and also a Spanish-speaking collaborative for promotores. And the next meeting date is here, January 27th. So if you're a member, please join us because we're focusing in January, we're doing a deep dive, culturally aligned around mental health. And I think you'll really benefit from the space that's created and also from the content that's shared. Next slide. Okay, thank you so very much. I know we've answered some of the questions. What are some others? Let's see, Benjamin says, can CHW leaders join the collaboratives in the future? So if you're a CHW who is a CHW network leader, yes, absolutely you can join. These collaboratives are for CHWs, not for allies. So if you're interested, in other words, we ask our membership, if you're interested in a special collaborative that is for allies, then please just let us know, Ben. But right now, those sessions are for members. Are there other questions? If you maybe raise your hand, I can try to get to folks. The chat is very full, but I'll try to scroll through. Oh, you're welcome, Benjamin. Other questions from the group? And I want to thank everybody for staying so long. We had 101 at the top and 88 participants. Yes, I see Zeno Wellness Group.
Yes, thanks, Denise, for having this space. Thank you all for having this space. So my name is Priscilla Zeno. I'm with Zeno Wellness Group. I am actually a certified peer recovery specialist, but I'm also a certified community health worker.
Yes.
One of the things that I have been working diligently on is training. So I'm also a trainer by trade. So right now I am, figuring out more ways to close the gap so that peer recovery specialists as well as community health workers in actually going to both trainings and seeing that there's such a small gap between the information that's being lost between the two industries, how we can close that small gap so that those who are maybe CCHWs and want to become peers, or, those, who of course, who align with that. And then those who are peers who can align with CCHWs. I know that you guys don't do training right now. So my question is, if I'm looking to put something together that would help or assist closing that gap and then getting the word out, that's one. And then two, also, although I am in a rural area, we do travel around the Hampton Roads area, and we don't know if there's a network already here, but we'd like to start a network, but we're lacking the funding to do that as well on top of the training. So how do we get that as well?
Yeah, thanks very much for the question. A couple of things. On our website, we have a list. It's under the membership tab. And it has a list that we update regularly, which are different CHW training sites, different CHW networks, associations, or coalitions. So if you haven't visited that site, I would say start there and see who is in your local area, your county, your state, et cetera. Because again, as we connect across the country, we're meeting additional groups. As I mentioned, there is, for a community-based organization, there is no one place that you can go to request funding. A lot of funders don't yet know that CHW networks or alliances actually exist. But if you are trying to collaborate and mobilize CHWs across the state, and again, I don't know what state you are in, as I mentioned, there is funding from the Centers for Disease Control that comes through your state health department. States may have other funding through different equity initiatives, et cetera. So, the shortest answer is to visit our partnership page and ask us all these questions, and we can have a more substantive meeting, or you can do some research on your own, contacting your state health department, building that relationship. You can also build a relationship with an existing training or CHW Promotora Association and see if they're interested in your training, and create it as continuing education or as part of their core competencies.
Okay, yeah, and really quick.
Next question?
Oh, yes, really quick. Okay, so two things. One, the thing that I have seen is that a lot of times when the grants come, a lot of the bigger organizations get these grants. So what happens is a smaller organization such as mine, woman-owned, minority-owned, small business who is doing the CHW work, we never see those funds. Why? Because we don't have the resources for someone to come in and help us put that grant together. So I'm wondering, is there something that your association is doing to help close that gap so that we can be able to at least receive the funds? I even tried to work with one of the bigger organizations in the Richmond area, and even with my expertise, that I still wasn't able to get connected with that.
Yeah. Well, first, this is an equity issue, and so it's not going to disappear quickly. I want to be very frank about that. There are probably many stories here of individuals on this call who are working as a CBO, as a CHW-led organization, who have the same experience. It's one of the reasons that we developed the Community-Based Workforce Alliance. So as Aurora mentioned, we are building capacity with CBOs. We engaged over 900 CBOs who registered for the webinar that we did back in June to help them apply for HRSA federal funding or to figure out, how to partner, et cetera, and over 650 attended. So the Community-Based Workforce Alliance, and hopefully that link is in the chat, I would actually encourage you to join if you want sort of long-term support. Now, in 2022, as we said, we are sharing with the CHW networks as we have since March of 2020. Any funding opportunity that comes forward, we share, and we provide recommendations and guidance on how they can partner. But this is an advocacy issue. It's not going to go away quickly. And CHW's lacking agency, lacking voice is historic. It's systemic, and oftentimes, it is a long-term effect of racial inequity. When you talk about tribal organizations, promotora organizations, organizations from our Pacific Islanders, our Native Hawaiians, our Alaska Natives, not being able to access this funding. You'll see the blog that we pulled together and some of the advocacy that we're doing there. But if you want actual technical assistance, I would start by stepping into the Community-Based Workforce Alliance. And then I would also attend the CHW network calls that we have in January, because the first one is focused on sustainable financing.
Thank you very much.
Sure. It could be, Richard. He's asking if the question is about getting assistance with the grant application and grant writing. It could be grant writing, but it could also be partnership. So it could also be just sort of clarifying the value proposition. A lot of small CBOs may not have an audit. They may not be able to have the DUNS number, or I think they've changed that to SAMs. There are other requirements around financing and accounting and data collection. All of these can create barriers for community-based organizations. So I think, there are a myriad of challenges. Okay, other questions? I know we're just at time, but happy to take another question.
Do you need to be an actual 501c3 to be a to start a network, and is that, or a coalition?
No, the short answer is no. To access some funding, yes, you're going to need to have a 501c3 or a fiscal sponsor. But just to start, there are very informal coalitions that are not a 501c3. Some of them, as I mentioned, about 50% don't even have any regular source of funding. So none of those are requirements to network with CHWs, to organize with CHWs, and to mobilize. Are there other questions? Okay, perfect. Well, we are definitely at time, and I want to thank everybody for staying 2 minutes over. I want to thank Aurora and Peter for helping to host and man the chat today. We are so excited that you joined, and we'll be sending you a link to, sign up for the free newsletter so that you can get access to all of these dates and times and recordings and things of that nature, so you can stay connected. We're going to be sending out these slides as well, and everything that was hyperlinked you'll have access to. So read the sustainable financing report, watch the webinars on how to build and sustain a CHW network. Look at the different ways that we offer to partner, and of course, use our resources. We have a Partner With Us page, and you can fill out a very brief form so that we understand sort of what your needs are, and then we'll know if we can make referrals, make connections for you, or partner with you directly. So thank you all so much. Oh, thank you, Brooke, for becoming a member while on the call. That's so kind of you.